Good morning. I'm going to do a central line dressing change video for you guys just to help you while you're trying to study. One of the first things that you want to do is read your policy and procedure at your hospital and make sure that you're following what that hospital requires. Gather all your equipment. So you've got some just regular clean gloves. You've got a wound measuring device. You've got your bio patch if required by your hospital, and yours in your little kit says Demo B Patch Protective Disc, so that's what this is. And then you're going to need a dressing change kit. This kit has an alcohol swab and a chlorhexidine swab. Your hospital is going to let you know what kind of kit that they would like for you to use because that's the one they're going to be stocking. The next thing that I'm going to do is I'm going to come into the room and I'm going to introduce myself to my patient. I'm going to identify who he or she is by their armband. I'm going to ask them to state their name and their date of birth. I'm going to raise the bed. Nope, I'm going to wash my hands first. I'm going to go over to the sink and wash my hands really well, dry them really well. Then I'm going to come and raise the bed to a good working height. Make sure that you're not bending over and stooping over. Many years of that and you'll be having back trouble. I'm also going to ask for allergies to any of the tapes or cleaning products that I'm going to be using. And I think I'm about ready to get started. I'm going to position the client supine, have them turn their head away from the site that I'm dressing. If this patient is not going to be able to keep their head turned because they're not compliant, or they've got a cold and they're coughing, or the hospital policy requires, be sure that you bring an extra mask with you because you're going to need to mask that patient. You don't want them coughing and getting germs all over the field that you're working on. Okay, so at this point I'm going to put on my clean gloves, just regular clean gloves. I'm going to undo the dressing that they currently have on. This gets so sticky on this mannequin. Make sure that you hold the central line and don't tug and pull on it. Usually they're sutured in place, but you still don't want to be having a lot of pressure and tension on that and make it bleed again from that insertion site or just cause any trauma at all. It sticks so tight. Always move from the periphery inward. Hopefully your dressing won't be stuck quite so bad because you'll have real skin instead of this plastic rubbery stuff. Okie doke. So I've got the old dressing off. I've also assessed the site while I'm here. I'm looking for redness, swelling, drainage, and things like that. I'm going to move my garbage can just a little bit closer to me. I am ready to measure the length, and so I don't want to touch. I want to just kind of hover above. So there's 20, and then another 15 is 35. I want to also start to open my equipment. So I'm going to open this Demo Bio Patch right here. Just making sure not to touch anything inside and keep it good and sterile. Then I'm going to open this dressing tray and I'm going to put on my my mask. Remember, bring one for your patient if they need it. Okey doke. Then I'm going to put on some sterile gloves. Remember all the things that you were taught about sterile gloving. Keep your gloves, your sterile gloves above your waist. Never drop your hand below your waist. You're going to pinch on the first glove. And you can scoop on the second glove, but when you scoop, take that thumb back out of the way or you're going to be dragging this sterile thumb up your wrist potentially. Put your gloves on. Okay, once I have my gloves on, I can remove this out to the side. Don't go below your waist. And then I'm going to move this to the center here. I'm going to open all the things inside of here that need opening, like my alcohol pad, alcohol swab, should I say, my alcohol swab. And then I'm going to pop my chlorhexidine and have it ready. I'm going to also get my skin prep ready to use. I've got it over here too. So I'm going to start with the alcohol. And I'm going to work from the center outward in a circle. Center outward. Going over and under the catheter as necessary. Don't ever go back in toward the side. It's always outward. Once I'm done with that, I can take my chlorhexidine that I popped the wings, and I'm going to clean the center and go in a circle, going over and under that catheter as needed, moving way out, cleaning the whole area. Once you're done, throw that away. Then I'm going to take this skin prep pad, and I'm going to kind of estimate how much I'm going to need for this Tegaderm. I'm also going to grab the bio patch at this point. Grab my little patch. This should be allowed to dry. The alcohol should be allowed to dry. Then the chlorhexidine should be allowed to dry. On this mannequin, they don't have a body temperature, so it's not going to dry as quickly, but on a human, it'll take about a minute to a minute and a half for that to get good and dry, just depending on their body temperature and things like that. The bio patch should go right around the base, and you're going to see some little arrows that say up. So there's a certain part that goes up, and remember, handle this as little as you can. Even though I've got on my sterile gloves, I put my bio patch there. I'm going to take this skin prep, and I'm going to go around the periphery where I think my Tegaderm will be sticking. Take my Tegaderm, open it up, and then just center it right over the bio patch and the center of my central line insertion site. Take this little edging off. Trying to preserve that label that's on there. Come to the side, write your initials, the date, and the time. Take this off. And apply this to the edge. Don't ever put it over the insertion site, because people want to be able to, nurses would like to be able to assess when they walk into the room to see what that looks like. And let's see what else. Once I get all that in place, I am going to lower my patient. If I lowered the side rail, I would bring the side rail back up at this point. Discard of all my materials that I've used. And then I'm going to document that I did a dressing change, the date and the time of that dressing change, that it was done sterilely. I'm going to document also the measurement of the length of that catheter that was outside of their body and how they tolerated the procedure. I hope this helps you as you're going through and trying to study. Thank you, guys.